This morning, the city of Stockton is using some federal money from the American Rescue Plan to help people with nonviolent low-level 911 calls. Today, the city is announcing the start date of the new pilot program. Here to tell us more about it is City Manager Harry Black. Harry, good morning. Let's start with how this program is going to work.
Yes, good morning, and thank you for having me. During the pandemic, as we all discovered, we as humans, we're very, very fragile. And the pandemic really shed a bright light on just well-being considerations that we need to be mindful of all the time in terms of one another. And so the idea came to us to pursue the establishment of a crisis intervention, a mobile crisis intervention capability. And we are teaming up with the Community Medical Center of San Joaquin County. And tomorrow we will be officially announcing the start date of this first one-of-a-kind mobile crisis intervention program, along with our partner, the Community Medical Center. Tomorrow we'll be officially announcing the actual date that it will commence this month.
And of course, Harry, like I said, we want to talk some specifics about just how it's going to work for people. I understand, like, when people call 911, who ultimately will then be dispatched?
Yeah, so in essence, what we realized by looking at the data that somewhere around 5% of all of the 911 calls that we receive are really for non-police emergencies. So through mining the data, we're basically going to call out those calls, and they will be automatically routed to the mobile crisis unit. And they will be a team of various different disciplines from a professional standpoint. There'll be a behavioral health capability there. We will sort of triage whatever the situation might be from whatever that crisis is. And again, these will be non-police, criminal-related 911 calls.
Yeah, and Harry, there have been a lot of talks about this kind of thing, a lot of calls by community activists and other folks saying that there needs to be people that address mental health calls and not necessarily law enforcement. But when you get a call to 911, how will the dispatcher distinguish between the need for law enforcement and the need for this new crisis program?
Well, working with the Community Medical Center, working with our fire department, the police department, they are developing protocols to address that.
Okay. And I know that this is, again, a pilot program. It's going to start pretty soon. We have a full screen, a graphic that we want to show our viewers. The initial responses in downtown Stockton, how do you see this program growing in the future?
Well, we're going to start out with one mobile team, and we're going to take several months to sort of perfect that process. And then the idea is to add an additional 3 to 4 teams along 3 to 4 additional mobile units to complement this initial unit. So we're going to learn from the first one and then incorporate what we learn and grow the program into ultimately 4 to 5 mobile response units.
Yeah, this is a really interesting program, and we appreciate you joining us this morning to talk more about it. We're going to be sure to check back in with you because I know we'd be interested, and our viewers would be very interested in hearing just how this program works, and maybe other communities and other cities may be able to do something similar in their areas. Thanks so much for joining us this morning.
Thank you very much.